Today, I would like to give you an update on the work that was presented to His Excellency the Governor, Honorable Premier, Honorable Minister Hugh, the Deputy Governor, and myself on Thursday, April 9th. It's important for you to know that 3 groups of professionals were charged with reporting on the areas of clinical management of patients with COVID-19, testing protocols we will be moving to, and developing the testing capacity for COVID-19 across our islands. We are very pleased to have these reports to see the excellent joint working that is happening across the private sector and the public sector, and through primary care to the highly technical competencies of the critical care units. The Cayman Islands are blessed with the breadth and depth of facilities and professional experience it can draw on, right up to the ability for Health City Cayman Islands to provide ECMO, which is extracorporeal membrane oxygenation, and which provide essential oxygen to the blood whilst giving the lungs a chance to heal when they are most challenged. The Clinical Management Group presented their plans to look at patients with COVID-19 from primary care through to those that might need intensive care and ventilator support. They talked about how patients would flow through the system, how beds would be used across the island, and how overflow facilities might assist, which are being developed in the John Gray High School Gym, Jasmine Hospice, the Aston Ruddy Center in Cayman Brac, and others. They have also been sharing the latest scientific knowledge about treatment protocols for the best management care of our citizens. The testing groups has been talking through the challenges of increasing testing capacity. This is not as simple as it might first seem because there are a lot of steps involved in testing for COVID-19. The swabs needed to be taken, the sample needs to be processed, the RNA, which is the genetic material of any virus, needs to be extracted, and finally the PCR machine needs to be operated to look for evidence of viral particles. There are specialist people and supplies needed for each step. This group has been working to maximize the output of their testing facilities by combining the strengths of 3 hospital laboratories. Finally, a last group has been working on changing our testing protocols to widen the group which we test. And as you heard Dr. Lee mention earlier, however, I can confirm that we will be testing a number of frontline groups, such as certain hospital workers alongside the inpatients in the hospital and a wider category of people who present with any respiratory symptoms. I would like to thank the professional groups for their diligence and in particular the collaborative work they continue to do in the country's fight against the COVID-19 threat.